I'm Jennifer Carr. I am an assistant professor of surgery in the Division of Plastic and Reconstructive Surgery at University of North Carolina in Chapel Hill. I always knew that I was going to be a surgeon. I have no idea why, except for the short amount of time that I thought I was going to be a singing veterinarian, but that clearly did not pan out. But after that, something in me always felt like I was going to be a surgeon. I was always drawn to the sciences when I was younger, and surgery always spoke to me. Plastic and reconstructive surgery to me is, there's always something that's changing. It is so variable, and I think that the plastic surgeons are really the innovators within the surgical divisions. You have to come up with many different ways to do something, and there's so much variability even within the same day of how you can be doing a facial trauma case, and then a breast reconstructive case, and a transgender case. Things, even within the same day, are very variable, and we truly take care of the patients head to toe. Within the scope of what we do, within what I do, a lot of breast cancer reconstruction, and then also transgender health. My philosophy of care is that you, as a patient, you're the most important part of what I do, and that I exist to help you, and for whatever reason you have come to see me, there's been likely some misfortune that has brought you to me. And so whether that is cancer or trauma, really my goal is to have a conversation with you and as a team to come up with the best option for you moving forward. And whether that again is restoring form and function because cancer or trauma has taken that away, or with transgender surgery really helping you be the truest form of yourself. It's just all about you and I being a team. Who I am is really somebody who's here to take the best care that I can of patients, to get them back to their families, to their friends, to whatever it was that was meaningful to them. So I usually like to ask what people like to do when they're not here, and what helps them feel whole again, because I can do a surgery, but getting you back to something that is meaningful to you is really what I'm here for. And so sometimes that's not a single surgery process. Sometimes that's something that evolves over time. I love UNC because I feel like you walk in here and everybody just has a sense that they're part of something that's bigger than themselves. It's also easier the older that I get to easily, put myself in a patient's shoes. And a lot of patients come in here and they, have gotten, I see breast cancer diagnoses younger and younger and younger. And while I'd like to pretend that I'm not going to have a mammogram in the next couple of years, I feel like it's even these young patients that don't have a family history that are coming in here. And I think that those moments, you meet people and they're here in their most vulnerable moment. And I think that it's just very easy to recognize that any one of us could be crossing the street at the wrong time or not have a family history of any abnormality, and there be something new that we find any day. And so just to me, it really is possible to be in my patient's shoes.